Hello everyone, I'm Dr. Ekta Bhushan, teaching anatomy and physiology of exercise, sports medicine and exercise prescription at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine, but today in particular, we will discuss the topic therapeutic exercises. So, when considering exercise prescription in physiotherapy practice, it is important to understand the difference between therapeutic exercise and general exercise. General exercise is essentially a workout. It is exercise for wellness, overall health, appearance, fun, or leisure activity. Whereas therapeutic exercise is specifically for individuals who have a physical problem, impairment, which is often painful. So, let's see what is therapeutic exercise. So, therapeutic exercise is the systematic body movement prescribed under a plan intended to improve or prevent body impairments and optimize overall health. It is a cornerstone of many rehabilitation programs. So, rehabilitation professionals must be able to assess, analyze and determine the cause of client's pain or impairment. Exercises are then prescribed in order to address deficits in mobility or flexibility, strength and power, neuromuscular control, muscular endurance. So, often question arises that why includes therapeutic exercise in a treatment? Exercise interventions are beneficial as they enable individuals to self-manage their symptoms. Moreover, there is a large body of research to support its use in clinical practices. So, research supports the use of exercise interventions for long-term exchanges when compared to manual therapy alone. A systematic reviews by Lin et al. Appraised 44 clinical practice guidelines for musculoskeletal pain conditions. They found that exercise was recommended in all guidelines. However, when manual therapy is utilized, it should be used alongside other interventions, for example, exercise, psychological therapy, information, education, activity advice. So, exercise is supported over other therapeutic interventions. Let's see some of the terminologies related to therapeutic exercises. The first is exercise, so rotating joints in specific ways to challenge muscles. Forms, it is a topography of movement or a specific manner to perform an exercise to maximize safety and ensure gains in muscle strength. Repetition or reps, a cycle consisting of controlled lifting and lowering of a weight. Then set, several repetitions performed in a row without a break. Then 1 rep, the maximum weight that an individual can lift once. Then agonists are the prime movers, and antagonists, opposite to the agonist, can control rapid movements eccentrically. Then synergists, muscles that stabilize a joint around which movement occurs. Then tempo, a speed at which exercise is completed. Tempo affects both the amount of weight that can be moved and the muscles also. Now, let's see what is the aim of therapeutic exercises. So, the treatment is mainly aimed at reducing body's discomfort, pain and swelling. Once this program is done, it focused on movement recovery, muscle strength and endurance. Exercise which may include are balancing, strengthening range of motion, resilience, and plyometric activities. So, therapeutic exercise aim to restore mobility, enhance function and strength, improve gait and balance, and prevent and promote health, wellness and fitness. Specific workouts are designed to restore strength, power, work and endurance. Therapeutic exercises are also used for increasing range of motion, reducing discomfort, improving equilibrium and restoring functions. Now let's see the importance of therapy. So therapeutic exercise in people suffering from osteoarthritis, for example, can decrease pain and increase muscle strength, balance and flexibility. For those who have knee osteoarthritis, resistance training can help with pain and balance. Now let's see goal of therapeutic exercise. So the goals are decrease pain, enhance mobility or skill, prevent or recover from injuries caused by sports, work related injuries or car accident, rehab after a stroke, injury or operation, work to avoid a slip or fall, control a chronic condition such as diabetes, heart disease or arthritis, get to know how to utilize support such as a walker or cane. Now let's see some of the scope of therapeutic exercise in rehabilitation of sports injuries. So according to Kulund 1982, rehabilitation of sports is although closely tied to the modalities of heat and cold, but the most important modality is exercise, which does more than ice or heat to restore muscle and joint function and prevent fibrosis. This statement underscores the role of therapeutic exercise in the management of sports injuries. Therapeutic exercise also plays an important role in prevention of sports injuries. So it would not be an exaggeration to say that any phase of management of sports injuries is incomplete without the use of therapeutic exercise. At the same time, it is also true that inappropriate use of exercise during healing process has the potential to inflict further damage and complicate the process. For the judicious use of therapeutic exercise in injury management process, it is important to have familiarity with the various stages of biological process of healing of injury and the effect of exercises on healing process. Now let's see role of exercise in injury rehabilitation. So it reduces swelling, improve quality of repair, prevent and treat complication of stiffness, weakness and adhesion, maintain fitness, recondition injury parts to withstand higher load. So during the phase of inflammation and early repair, the part should be protected. In this phase, exercise should always be used in conjunction with ice, gentle isometric contraction of muscle of the injured segment. It requires to reduce the congestion and facilitate early healing. However, care should be taken so that stress is not imposed on the injured segment during exercise. During late healing and remodeling phase, therapeutic exercise becomes the mainstay of management. Therapeutic exercise is also required to deal with the complications of immobilization and also to influence the quality of repair. Now let's see the principles of therapeutic exercises. Though we also call it FITT, that is frequency, intensity, time, type, volume and progression. So let's start with frequency. So how many workouts do you in one time frame? Do you do in one time frame? So which can means many things. Some runners do doubles or 2 runs in a day. That means they could run up to 14 runs in a week, while some beginners run as little as 3 runs in a week. Just think how many workout session am I doing in a amount of time. So that is frequency. Then intensity. So obviously this is how hard you are working. Not so obviously, there are many ways to determine intensity. I can think of 5 off the top of my head. First one is calories burned per hour, percentage of maximum oxygen uptake you are at, or percentage of maximum heart rate you are at. Then the METs you are at. METs mean metabolic equivalent of task, which is how many times of you resting energy you are using, and where you think you are on the board, that is rate RPE, rate of perceived exertion scale, which goes from 6 to 20. Then time. So what is the duration? How long does it last? This could be talking about the entire workout session or a small part of it. It can range from a few seconds, like sprinting 100-meter interval in a workout, or throwing a discus, or to many hours. The male record of the Ironman triathlon is 7 hours, 45 minutes and 58 seconds. Then type. So what type of exercise you are doing? So this is talking about what activity you are doing and how specific it is for your purpose. This follows the SAID principle, specific adaptation to imposed demands. So that phrase sounds boring, but it means whatever stress you put on your body, it will adapt to get better at that specific thing. So generally, the more specific the training, the better. The swimming 1 hour a day won't prepare your muscles, joint and tendons for the beating or running. A full marathon on the road running will. So however, sometimes you want to focus on non-specific things to make you a more well-rounded athlete and prevent injuries. Deadlifts and swimming are not specific to running a marathon, but they are definitely going to help you in the end. Next is volume. So there are many ways of looking at the volume. It's a combination of different factors that gives a single number that you can compare easily between the workout. In lifting workouts, you can use the formula volume is equal to sets multiply repetitions multiply weights. So if you in workout you did 5 sets of 5 reps of 200 pounds bench press, that would be the 5 into 5 into 200 is equal to 5,000 pounds. So in workout B, if you did the 3 reps of 3 sets of 250 pounds bench press, that would be 3 into 3 into 250, that is 2250 pounds. So even though in workout B you are moving heavier weights, you have overall moving less volume of weight than a workout A. In fact, the Department of Health gives an volume measurement of how much endurance exercise the average person should get per week at 500 to 1000 METs minute, which combines the METs with minutes and measure of the time. Now the next one is progression. So this is how your training progresses and changes over the time frames. Now is a good time to talk about the cycles of a training plans. You can generally break them up to 3 cycles, that is macro cycles, mesocycle and microcycle. So the macro cycle can be an entire session, the training plan for a major race for a full year. The mesocycle is a phase of training running. Running plans are base, speed, race specific and taper. And within a mesocycle, some people do weekly cycles and other look at 9 or 10 days a cycle. So it's important to space these cycles out the right way. For example, if you have 8 insanely hard workouts in a 1 week, that is a microcycle, you are asking for trouble. And when looking at progressing from one macro cycle to another, like from cross country season to track season in a high school, some coaches have to a recovery mesocycle between them. Now classification of therapeutic exercises. So classification of therapeutic exercises on the basis of force required to produce movement, which is type 2 movement, and force required production, then active and passive. Inactive, that is a contraction of muscle. The passive is external force. So classification according to force and nature of exercising movement. Force is required to produce movement. For human motion, this force may be generated by the contraction of muscles or by the external force, such as force of gravity from another person or by machines. On the basis of the method of execution, exercises can be categorized into 2 broad groups: active exercises and passive exercises. The movements produced by the contraction of muscle is called active movement, whereas movement produced by external force is also known as passive movement. So the active exercise is the repetition of active movement which require muscle contraction to produce and control any movement. Often the muscle contraction is voluntary, but many a time exercising movement can be produced by reflex contraction of the muscle. Contraction of muscle is produced movement is the essential feature of active exercise. On the other hand, passive exercise does not require any muscle contraction to produce movement. In this type of exercise, movement is produced by the application of some external forces. So passive exercise is usually done by some other person or by machine. Sometimes the force of gravity is utilized to produce passive movements of a body part. Let's see what is passive exercises. So passive exercises are directed toward the flexibility of body parts, reflexed passive movement, forced passive movements and stretching are the subcategories of the passive exercises. So during relaxed passive movement exercise, a joint is moved through a existing range of motion. Forced passive movements are localized, quick movements where the joints are moved passively beyond the existing range. These are also referred as as manipulation. Both the exercises can be applied to physiological movement or accessory movement. Physiological movement are the movements which a person can produce voluntary: flexion, extension, abduction, adduction, rotation are the physiological movements available in the human joints. Accessory movements are those movements that take place in a joint during normal movement but cannot be performed actively by an individual. They consist of a spin, glide, and slide of one joint surface over the other. Execution of accessory movements required specialized knowledge of joint anatomy and biomechanics. So stretching exercises refers to taking the joint to such position where a given muscle or a soft tissue is stretched to its maximum possible length. It is a therapeutic procedure that aims to elongate the soft tissues of the body. These are exercises which are usually directed toward the muscle. The muscle is elongated passively to its maximum length. Stretching exercise is also known as flexibility exercises. So the external force for stretching is provided by the physiotherapist or by the patient or by mechanical means such as pulley or weights. Passive stretching, active stretching and ballistic stretching are the subcategories of stretching exercises. Passive stretching is performed by another person. Active stretching refers to the technique in which the patient does stretching himself. Here the force of stretching is generated by the contraction of the opposite muscle group or by the gravity. Now let's see active exercise. So active exercises are categorized on the basis of the amount of assistance and resistance provided during execution of exercises and also on the basis of the type of muscular contraction required to produce movement. So on the basis of amount of assistance or resistance during the execution of movement, there are four main categories of active exercises: free exercises, assisted exercises, resisted exercises and assisted resisted exercises. On the basis of the type of muscular contraction, the active exercises can be classified as isometric, isotonic and isokinetic exercises. Isotonic exercises can be further categorized as isotonic concentric and isotonic eccentric exercises. Active exercise can also be classified on the basis of number of muscles required to produce a movement. Exercises utilizing the movement produced by contraction of a single muscle can be termed as isolated muscle exercises, whereas exercises using the movement produced by several muscles groups can be termed as a mass movement exercises. So now we'll see some classifications of therapeutic exercises according to objective. So strength exercises, mobility, flexibility exercises, balance exercise, breathing exercise, endurance or cardiopulmonary exercises, skill improvement or exercises. So the strength exercise is directed at increasing the muscular strength, whereas the focus of mobility exercise is to maintain the range of motion, joints and flexibility of body parts. Balance exercise works at improving the coordination of various muscle groups and enhance the ability to maintain equilibrium in the situation of reduced base of support. Now we have come to conclusion. So exercise is the repetition of movement For a specific purpose, the exercise used for management of decrease and injury is termed as therapeutic exercise. On the basis of a method of execution of therapeutic exercises can be categorized in two broad groups, active exercise and passive exercise. In active exercise, the movement is produced by the contraction of muscles, whereas passive exercise used some external force to produce the movement. Each of these two categories has various subgroups. So now I hope you understood the meaning and concept of therapeutic exercises, its aim and scope, classification of therapeutic exercises, and its importance. That's all for today. See you next time. Thank you.